Let's quickly get into today's topic. Pharmacoeconomics explained, definition, history, and why it matters. Pharmacoeconomics, a term that may sound complex, holds significant importance in today's healthcare systems. It addresses the crucial question of how we determine the value of medical interventions, especially considering the billions spent annually on medications. Not every drug offers the best value for money, and this is where pharmacoeconomics plays a pivotal role. Understanding this field can enlighten us on making informed decisions on healthcare spending. Pharmacoeconomics is defined as the study of the costs and benefits associated with drugs and medical interventions within healthcare systems. It evaluates the economic aspects that influence decisions regarding the allocation of resources towards pharmaceuticals. Key concepts in pharmacoeconomics include 1. Cost effectiveness. This concept involves balancing the cost of a drug or intervention against the health benefits it provides. It's essential to evaluate whether the health outcomes justify the expenses incurred. 2. Cost-benefit analysis. This measures the monetary value of outcomes from medical interventions, providing a comprehensive view of costs versus benefits. 3. Cost-utility analysis. This analysis often employs measures like quality-adjusted life years (QALYs) to assess the value of healthcare interventions in terms of both quantity and quality of life. Example: consider the drugs used for treating diabetes. Drug A is less expensive but less effective, while drug B is costlier but provides better health outcomes. Pharmacoeconomics helps in deciding which drug offers better value for healthcare systems and patients. History and evolution. Pharmacoeconomics is not a new discipline. Its roots can be traced back to the 1960s and 1972 when rising healthcare costs emphasized the need for economic evaluations in healthcare. During the 1980s and 1992, pharmacoeconomics was further formalized with the advent of textbooks and guidelines, shaping it into a recognized field of study. In the 2000s, the discipline saw widespread adoption by governments and insurers worldwide to inform decisions on drug coverage. A key milestone in its evolution was the establishment of organizations like ISPOR International Society for Pharmacoeconomics, which aimed to standardize methodologies globally. Why do we need pharmacoeconomic evaluations? 1. Rising drug costs. Modern therapies, such as biologics and gene therapies, come with hefty price tags, costing millions. Pharmacoeconomics plays a crucial role in deciding if their benefits merit the expenses. 2. Limited healthcare budgets. Healthcare systems often operate under financial constraints. Pharmacoeconomics ensures that funds are allocated in a manner that maximizes impact and value. 3. Patient access vs. affordability. It helps in navigating the delicate balance between allowing access to innovative treatments and maintaining affordability for healthcare systems and patients. 4. Policy and reimbursement decisions. Governments and insurers rely on pharmacoeconomic evaluations to determine which drugs should be included in coverage plans. Real-world example: in the case of COVID-19 vaccines, pharmacoeconomics was instrumental in shaping pricing and distribution strategies, ensuring cost-effectiveness while maintaining accessibility. Introduction. Formulary management is a crucial process for both insurance companies and hospitals, as it involves selecting the most cost-effective drugs for coverage to ensure patients receive optimal care without unnecessary financial burden. Pharmacoeconomic evaluations play a vital role in this decision-making process, guiding the selection of medications based on criteria such as cost-effectiveness, cost-utility, and budget impact analyses. Types of pharmacoeconomic evaluations. Understanding the different types of pharmacoeconomic evaluations is essential for healthcare professionals involved in formulary management decisions. 1. Cost-effectiveness analysis. CEA emphasizes the cost per health outcome, such as the cost per life year gained. This approach is pivotal for evaluating the monetary value attributed to extending patient survival or enhancing health outcomes. 2. Cost-utility analysis. QA incorporates a metric known as quality-adjusted life years (QALYs), which accounts for both the quality and quantity of life gained. QA allows formulary committees to assess a drug's impact on patients' overall well-being and life expectancy. 3. Budget impact analysis. BIA examines the financial impact of drug inclusion on healthcare systems, providing insight into how decisions might affect budget allocations. Real-world example, consider a scenario where two diabetes medications are under review. One drug demonstrates superior clinical outcomes, but its cost per kale is notably higher than its competitor. A comprehensive pharmacoeconomic evaluation can assist in determining which drug offers better overall value by weighing clinical benefits against financial implications. Role in formulary decision-making. Formulary committees utilize pharmacoeconomic data to make informed decisions, balancing clinical efficacy and safety against financial considerations. For instance, there might be a case where a drug is rejected or approved based on its cost-effectiveness. Such data-driven decisions ensure that patient care remains both effective and sustainable. Challenges and considerations. However, employing pharmacoeconomic evaluations is not devoid of challenges. The data from real-world usage may differ significantly from clinical trials, raising concerns about the reliability of conclusions. Ethical considerations are also prevalent, especially when weighing cost against patient access to potentially life-saving drugs. Conclusion and call to action. In summary, pharmacoeconomics is pivotal for making value-based formulary choices, ensuring that healthcare systems maximize patient outcomes without undue financial strain. Viewers are encouraged to explore guidelines from authoritative entities like ISPR and NICE for practical implementation approaches. As a provocative seed for further discussion, consider the question, should cost always influence drug coverage decisions? Pharmacoeconomic evaluation's role in formulary management, a perspective of value and cost balance. Comment the answer for the question in the video and let's catch in the next video.